The Clinical Compass is sponsored in part by Living Waters Health and Mental Wellness and by True North Medical Care.
Hello, everyone, and welcome to the Clinical Compass. My name is Chad Stencil, and I'm one of the hosts. Today, I'm joined by my co-host, Jonathan Rohde. What are we going to tell our viewers about today, Jonathan?
Yeah, thanks, Chad. So today we're going to discuss medications, and that is medications after your provider said, hey, let's start a medication. What are the things that you should expect to talk about? So to jump in, we've talked about previously primary care, billing, and this one's medication. So starting wise, the idea is you go in for a problem, right? You come to one of us and we say, oh, we've diagnosed you with X, Y, or Z. And then the next thing is, hey, I want to start you on a medication. So Chad, why don't you run us through what you think about when you're starting a med?
Yeah, a couple of things before I even consider starting a medication is we have to get a history from the patient. What medications do they currently take? Do they have allergies? Why are we prescribing this medication? What are the indications for it? And have the patients ever had this medication before, or have they had any kind of reactions to it?
Right. And I think one of the important pieces as you're talking about the indications is that sometimes we use medications off-label. So when you look at medications, they have an FDA approval for a specific use, but sometimes providers will use medications for an off-label use. And so that's where it really becomes important that we partner with our patients so that they know why they're using this medication, right? Because they may go to another provider and the provider's like, I don't understand. And so again, it's just so that everybody's on the same page, right?
True. And so I like to start with the indication of why am I prescribing this med? What problem did the patient come into my office that I would, consider starting a medication? And then I think the next step, if you will, is to make sure that they don't have an allergy to this medication. Can you speak to allergies to medications?
Yeah, so that's a good idea, right? Before we even think about starting a medication, we need to know whether our patient can actually take the medication, right? So some of our antibiotics have some cross reactivity with things. So like sulfa, if I have a sulfa allergy, I can't take X antibiotic. And so again, it's important to go through those allergies, right? Medication allergies, environmental allergies, and then be able to say, okay, after we have those allergies, we've excluded those medications, now what's left?
Yeah.
Right? And so what's next?
Yeah, so then I like to ask my patients, or I should say go over all of their medications. So we call that medication reconciliation, right? And it's something that we should be doing, but by law, we have to do. So every encounter that you have with your medical provider, they should be going over your medications. And that doesn't just include medications that were prescribed, right? This is medications that you may have bought over the counter or you're getting from a specialty pharmacy or things of that nature, right?
Yeah, don't forget the supplements, right?
And supplements, we can never forget supplements because we know that there are so many supplements out there that can interact or make your medications that you're currently taking less effective or dangerous side effects, right?
Right. It may cause an actual side effect. And so super important for us to get all of those things. So as you described previously, it's prescribed medications, over-the-counter medications, any supplements. So then once we get that medication reconciliation, one of the things may be that your symptom that you're coming in with could be from one of the medications you're on, a polypharmacy thing where you got started on X, Y, Z medication and not realizing it, you had a side effect from one of those and then got started on another medication. And so that's where that polypharmacy comes from, where it's really important from our perspective as the person prescribing to go through those things and to make sure that we're not adding to that, but actually helping our patient with this med.
Exactly. Polypharmacy is a big issue, and it's something that providers need to be very cognizant of. Everybody should be aware of it. And I think we do this in our clinic where we not only look at what meds you're on, but if we add a medication, how is it going to interact? And another thing that we talked about, are you on supplements and different things? There's also food categories, right, that can interact with medications. Can you speak to a little bit of that? We talked about this earlier.
Yeah, we were thinking grapefruit, right?
Grapefruit.
So grapefruit interacts with medications in a way that some of them don't work as well, or they can have significant and severe side effects. And so it's very important that we talk about all of the possible interactions that can happen with these medications.
Yeah,
right?
yeah. So there are food categories out there that can affect medications, how you metabolize them, how they interact. So that's another category, I think, just taking the time to spend with patients and really go over medications. So now I like to go to the next step. If you're going to prescribe a med, what do you talk about, or what are you thinking, or what's the next step?
So now you've gotten the allergies, we've eliminated certain meds, we've looked through your medication reconciliation, decided if any of that was causing these struggles, and next is, okay, I'd like to prescribe X drug. And so then it's talking about what the indication is. Right? This is why you came in. This is why we're prescribing this particular medication. With any medication that's out there, there's going to be some type of side effect that has been found. So when they did the testing, they're going to find side effects. And that'll range from mild to all the way to severe, right? And so the next piece is educate the patient on indication. So why am I giving you this medication? But then what can you expect? What is the expected outcome that we can expect by you taking this medication? And outside of the expected, that's where that side effects start coming from, right? So we need to talk about what are some of those side effects and how do we navigate those, right? I mean, do all side effects need you to stop the medication?
Right. No, that's an important topic that you bring up. As providers, we should definitely be talking about side effects. We know that most medications have side effects. I try to talk to all of my patients and warn them, even about the mild side effects, right? So it's not a surprise when they're at home and they have maybe a little bit of dizziness when they stand up, or maybe they're a little nauseated. Those are not things that we need to be super concerned about. We don't need to stop the medication. We can proceed on. What is one thing that you would tell your patient to report immediately, either to a provider or go to the emergency room?
Yeah. So what Chad is alluding to is that we have mild, moderate, and severe side effects. And so the classification that he's talking about would be severe, right?
Yeah,
so like an anaphylactic type reaction, swollen tongue, difficulty breathing, severe lightheadedness, dizziness, chest pain. And so it's, as we alluded to, it's important to talk about these side effects so that if it happens, what am I going to do? Right? And so we talk about the side effects so that we can develop a plan together of, we're prescribing this medication. We know that there's these known side effects. We also know that there's these potential really bad ones. What are we going to do? And we talk through that with our patients, right? You have mild side effects. You can call the office. We can talk through what to do next. If it's starting to get into something concerning, never call the clinic. You always call 911 or go to the emergency department. If you are ever concerned about something severe or life-threatening, it's 911 or the emergency department.
Yeah, and that's something I tell all of my patients when I start any new medication. And it doesn't exclude any meds, right?
No.
So if I start you on, an NSAID, or if I start you on an antibiotic or a blood pressure med, any med can cause severe anaphylactic reactions or severe allergic reactions. Those are things that we have to discuss with our patients at every visit, especially when we start a new medication. And they need to be aware of it, and they need to know who to call. And I'm glad that you pointed out that if you have a severe reaction, the only person or people you should be calling is 911, and then go to the emergency room, whether it be ambulance or private car, depending on the severity of the reaction.
Right. And so then, that next piece is, once we've gotten to, okay, we're talking about side effects and, that range of side effects from mild to severe. Okay, well, now we've got the indication. So let me back up. So from the beginning, we got allergies, we got our med reconciliation, and then we went through indication, we've gone through side effects and expected outcome. Then that last piece that I would expect is, okay, when am I going to follow up? This is always before we go to the pharmacy, right? So we'll get to there. But the next is, now that I have this medication, like, when do I follow up? When should we follow up? And I think that goes into the plan, right?
It does. Anytime I start a new medication, or if I'm even adjusting a dose on medications, I like to talk to my patients and just say, hey, this is a new class of medication for you. You've never taken it before. It's not that I'm overly concerned, but why don't we follow up in 1 to 2 weeks, depending on the category of the medication, right? And then most patients are okay with that. They like to have close follow-up to know that the medication is working, not working, or whatever. So I think those are great topics of discussion. And we're going to take a short break here on the Clinical Compass, and we'll be back in just a few minutes.
Enhance. 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 Too much. Unenhance.
Guys, it doesn't have to be this hard. If you want to watch Town Square television programs, just go to townsquare.tv/streaming to find Town Square's community programs and your city or school board meetings. Or look for the Cablecast app on your smart device and search Town Square Television.
At True North Medical Care, care is in the name. True North is proud to provide personalized, evidence-based medical care designed to help you feel your best. Offering in-person appointments in Edina and virtual visits to meet you wherever you're at. True North Medical Care and family nurse practitioner Chad Stencil are here to help you empower your healthcare journey. More information can be found at truenorthmedicalcare.org.
I donate to Town Square Television because it's a great chance to be able to be part of your local community, kind of stay in touch and know what's going on and be a good citizen.
It's so hard to get local news now, but Town Square focuses on our 7 communities and whatever's going on in our schools, in our cities, at the county level. There's no better place for local news than Town Square TV.
I just love the things you do, love the things you do.
With a dedication to compassionate, faith-based care and developing a partnership with every patient, nurse practitioner Jonathan Rohde at Living Waters Health and Mental Wellness in Edina is here to guide you along every step of your healthcare journey. Offering focused mental health care and primary medical care services, Living Waters Health and Mental Wellness is proud to be a space where healing begins. More information at livingwatershmw.com.
Hello, everyone, and welcome back to the Clinical Compass. My name is Chad Stencil. I'm a host, joined today by my co-host, Jonathan Rohde. Before we went to break, we were discussing medications, going to your primary care provider. We discussed what med you're going to be put on, the indications, allergies, possible interactions. What happens next?
Yeah, so Normally, your provider's going to send in a prescription, right? Back in the day, that prescription was written down on a piece of paper. I don't know if some of you remember that or not, but prior to the electronic medical record, we had paper prescriptions. Most of the time these days, it's going to be an electronic prescription. So you need to let that provider know, where do you want your medication sent to? Right, and so whatever pharmacy you've elected. Then the next piece is, okay, now I go to that pharmacy, right? And that pharmacy may be due to location, right? It's in your neighborhood. It's a pharmacy that you go to pretty routinely. And then you get there, and in a perfect world, right? Your medication's ready. You pick up your medication. The pharmacist, who is really an expert in medications, is right there, and they should be the one that's able to answer questions that you have, right? So sometimes we forget the side effects that we discussed in the office, and so that pharmacist is really a resource for you. Then hopefully your insurance covers the medication. You go home, you take the medication, and all is good. But as we know, normally it doesn't work out that way. And so one of the things that is really shocking to patients is, I go to the pharmacy and I find out, man, this medication is really expensive. What do I do then? So thoughts?
Yeah, we have a lot of patients that unfortunately go through this, right? We prescribe a med. It's the best medication indicated for what we're treating. They get to the pharmacy, and the pharmacist has their insurance. They've run their insurance, and for some reason, the insurance doesn't want to cover that medication. And the out-of-pocket cost of some of these medications can be extremely high, right? And people don't have that type of money to pay $1,000 or more dollars for a medication. So what is the process after that? Usually the pharmacist will tell you, hey, insurance didn't cover this. Do you want to pay for it out of pocket? So there is the option. You can pay for it out of pocket if you want to. Most people opt not to do that, especially if you're already paying, for medical insurance and prescription coverage. The other option is you can tell the pharmacist, hey, I can't afford that. Are there any programs that we could possibly do? That's one option. The other option is to kick it back to the prescriber, and then Jonathan or I get an email notification or something in the EMR that says, hey, this medication wasn't covered for X, Y, and Z. You now have to do what's called a prior authorization. Have you done a prior authorization? Tell me about the process of those.
Yeah, so I have done a prior authorization, and it is extremely frustrating for patients, right? You've already gone through going to see your provider because of an issue, right? So I've got a struggle. I go to my provider. They prescribe a medication. Now I try to go get that medication, and the insurance company says, no, we don't cover that, or that's too expensive. You need to submit a prior authorization. And what that is it's a way to tell the insurance company this medication is needed for this particular reason. It's a way to say, I don't believe that the patient should get X, Y, and Z medication because this is the best or the most indicated for the reason. Now, in that prior auth, a lot of our patients believe that once we submit that, the medication is going to get covered. Unfortunately, that's not the case, right? And so sometimes these prior auths come back and the insurance company covers it and we're happy and we all, throw a party. Sometimes they come back and they say, no, not this medication. You need to try A, B, and C first, and then you can possibly get to this medication. Or if it's not on formulary, they may just deny it across the board.
Across the board, yeah. It's a long process, and sometimes it can be super frustrating. I know that when we do prior authorizations, if a patient needs a medication, we will sometimes substitute that for a different medication, right, in the same class.
Right, and so that's one of the things that also, your pharmacist can be helping you with, right?
Yeah,
like you go there and, the pharmacist knows, hey, this is going to need a prior auth. Well, what are some other medications that are covered by my insurance company that we can discuss with my provider, right? as a provider, we think that the appointment has been successfully completed once the patient leaves and we've prescribed that medication. But we all know that once the patient gets to the pharmacy, that things can change, and we may need to change up the treatment plan so that our patients can get the meds that they need right now.
Yeah.
Right.
And a lot of times, insurance companies will give a medication that they prefer the patient be on. And if that aligns with the condition that we're treating, a lot of the times I'll do that. Especially if it's something that the patient needs, I'm okay with giving that substitute medication for the initial medication just to make sure that our patients are being treated and not left untreated, right?
Right.
And there's no real easy way to tell patients how long these prior authorizations are going to take. Some take a couple of days, some take weeks, right? It depends on the specialty of the medication, how much it costs, where it's coming from. Maybe that pharmacy doesn't even carry it and they have to get it from somewhere else. So those are all obstacles that we run into. But there's other obstacles that we run into when we get to the pharmacy as well, right? So
yeah. And I think one of the big things with these prior auth obstacles, it's really that we're all trying to get the patient the best care that they can. And these insurance companies, it's not that the medication cost so much, but it's the different contracts. We talked about this in the billing segment last time. These insurance companies have certain contracts and they cover certain medications. And so 1 year, this X medication could be covered, but then the following year, a new contract is made for pharmacy benefit, and all of a sudden this med isn't covered. So med you've been on for X number of years, no longer covered. Now we have to switch meds. So there's a lot of nuances with trying to get medications for our patients, especially within the confinements of whatever their insurance is, right? But to help navigate that, though, there is the option for cash-based paying for medications versus we talk sometimes about compounding pharmacies. So what are your thoughts about compounding pharmacies?
Yeah, so there are different options for different medications. If a traditional pharmacy isn't covered by your insurance or that particular medication isn't covered by your insurance, there are compounding pharmacies that can make certain medications. And it's not going to be the exact medication. It'll be a generic type medication that's compounded in their labs. So that is an option, and sometimes the cost of that can be a lot cheaper. But let's say in a dream world, we send a prescription, we have to do a prior authorization. We fill out the prior authorization while the patient's on a substitute medication. The prior auth comes back and it's approved. What do you tell your patients once that medication's approved, or how is the follow-up with that? And then talk a little bit about refills for certain meds and other meds.
Yeah, so once, perfect world, prior auth has come through, yes, we can have this medication. At the first part of our segment, we were talking about how it's important to have a planned follow-up, right? So I'm going to check back in at a certain amount of time to make sure that the medication is working like it's supposed to, or you have side effects, or do we need to change course at all? Now, one of the things with follow-up and refills, so when you're prescribed a medication, there's something that's called a refill. And the original prescription can have a set number of refills on it. And what happens is after that first prescription's done, you take all your pills, you call your pharmacy and you say, hey, I need a refill. If there's refills, then they just automatically refill the prescription. Sure. But some medications throughout the United States do not allow for refills. So, some of my patients sometimes expect a refill, I guess is the point. And so stimulants, so medications for ADHD, no refills on those. So the patients need to come back, they need to follow up, we need to make sure that they're doing well. And these are high-risk medications, which is the reason for the consistent follow-up. Opiates are another one. So controlled substances in general are a class of medication that we're concerned about, and we're not going to be giving refills on. We're going to want follow-up, right?
Yeah, and I think we should let our viewers know that there's certain classes of medications, like you said, opioids, those controlled substance medications, Adderall, the ADHD meds, also benzodiazepines that people take for anxiety and different things. Those medications we're not allowed by law to give refills. And also, the patient needs to follow up with us every time they need to get a refill. I think that's very important to tell our viewers.
Yeah. And it comes down to the safety of our patients, right?
Yeah.
So we just want the best care for our patients, and we want you to be informed to know what to expect to get from your provider and the information you're supposed to glean from your provider when getting prescribed a medication.
Awesome. Thanks, Jonathan. We want to thank our viewers for joining us today on this episode of the Clinical Compass. Please stick around for After the Credits, where Jonathan is going to share a tip on possibly saving you money on your prescription drugs.
Hello everyone, before you go, I wanted to bring you some cost-saving options for medications. We've been talking about medications during our segment today, and we know that those costs can be quite expensive. So one of the potential options would be to get a cost-saving coupon. So GoodRx is a website where you can go look up the medication you've been prescribed and see if there is a cost-saving coupon that you can bring with you to the pharmacy. Another alternative would be if the medication is really expensive or brand new, the manufacturer may have an assistance program that would help you with that medication cost. Third potential option would be to go to a pharmacy that does transparent pricing, like Mark Cuban's Cost Plus Drug Company, where the company shows you the cost of the medication plus their surcharge plus their shipping so that you can evaluate that against your own pharmacy.